Morning. Good morning
Good
to
morning po.
everybody.
Good morning po. Ma'am, can we start po?
Yes, please.
Apo. Good morning, everyone. Good morning, Yusik, and good morning to all our media partners. Welcome to today's Media Forum, September 16. Before we start po, Yusik, given updates regarding Vida ang Disiplina.
Yes. Good morning to all of you and welcome to our media forum. Ngayong umaga ay pangungunahan po ni na Secretary Duque at saka Secretary Anyo ang paglo-launch ng Vida ang Disiplina. This is a campaign of the Department of Health na nagaganapin ito sa Camp Crame. Ang kampanya pong ito ay naglalayong mas maisulong po ang ating panawagan sa ating mga kababayan na i-observe ang minimum health standards upang mas mapababa natin ang bilang ng mga kaso ng hawaan sa ating komunidad. This is a partnership between the DOH, the DILG, the private sector, and our local government units, and of course, the local celebrities who will serve as ambassadors of this campaign. Maliban po kay Mr. Alden Richards, meron pong ibang mga celebrities ang makikibahagi sa kampanyang ito para po tulungan tayong i-communicate ang ating call for behavior change sa ating mga kababayan. Nagpapasalamat po kami sa lahat ng mga local celebrities na libre, walang bayad na nakibahagi sa kampanyang ito.
Thank you, Yusik. We will be moving on to the media forum proper. For the first question submitted yesterday, we have Claudette Macon-Siriaco of the Business Mirror. She asked, what was the reaction po of Secretary Duque, who sits as chairman of the PhilHealth Board, on the filing of charges against 6 former and current officials of PhilHealth for their alleged involvement in the anomalies in the government state insurance?
Claudette, lagi naman sinasabi ni Secretary Duque na bukas yung tanggapan namin, pati ang PhilHealth, sa anumang mga investigasyon na gagawin para malalaman natin ang totoo. And of course, dito sa nangyari nga na merong ginawang investigations at merong mga gagawin or na-charge or na-filean ng kaso. So ang kagawaran ng kalusugan, pati si Secretary Duque has always reiterated that he supports this kind of moves. So kung sakasakaling mapapatunayan sa proper court of law na talagang may mga issues tayo or gaps ang ating mga opisyal, yung mga nararapat na sanctions ay dapat ibigay. So, suportado ito ni Secretary Duque.
Thank you, ma'am. For the next question, since majority of the students in public schools will use self-learning modules, how would you disinfect the materials? Is it okay for schools to use UV light for disinfection, just like what they did during the dry runs?
Meron naman tayong protocols for that, Claudette? Ang lagi nga nating binibilin sa ating mga kababayan, anything that we buy or we bring outside of our home, babalik natin sa bahay, kailangan nililinis natin bago natin ipasok sa ating mga bahay. We disinfect these things. Ang atin pong nasa protocol, ang pinaka-nire-recommenda pa rin natin, and this is supported by evidence, yung direct wiping of surfaces, na gumagamit tayo ng disinfectant with a rag. Yung spraying is not recommended because it can aerosolize the virus. Now, when it comes to UV light, wala pang sapat na ebidensya hanggang sa ngayon na kung anong klase at saka anong dose ng UV ang magkakaroon ng tamang epekto para dito sa SARS-CoV-2 virus. And then another thing, itong UV light na ito, meron din itong harmful effects kasi para sa mga tao. Kapag hindi yan nagamit ng maayos, halimbawa ginamit sa bahay, hindi naman marunong yung mga tao na gumamit, maaari magkaroon ng harm. Pwedeng magkaroon ng burns sa skin nyo, pwede rin sa mata, na makaka-apekto sa mata. And meron pang mga iba pang mga harmful effects na sinasabi nito. So ang atin pong nire-recommenda, although ang sinasabi nga po natin, yung UV light kasi, it has been a known disinfection procedure for so long already in our health facilities. Sa ospital po, talagang yan ginagamit. Wala pang SARS-CoV-2. Ito po ay ginagamit na talaga pang disinfect ng mga health facilities. And this is done in a proper manner. At saka alam po ng ating mga health facilities kung paano gumamit at tamang dose yung nagagamit. So sana kung gagamit tayo nito, yun pong meron po tayong ebidensya at meron po tayong guide para magawan po natin ng tama na paggagawa nito at ma-disinfect talaga yung ating mga gagamitin, no? Especially for children. But we still recommend, yun pong ating sinasabing direct disinfection by wiping it off with this disinfectant and a rag. Next.
Thank you, Yusek. For the next question from Red Mendoza of the Manila Times, he asked, the president in his latest speech said that he only trusts the vaccines made from Russia and China as other companies want to pay a reservation fee for the vaccines that they have produced. Is our vaccine panel being pressured by these pronouncements of the president? Has SOH discussed the intricacies of vaccine selection to him?
Hindi naman, walang pressure, no? Katulad ng sabi natin, kung ano man ang dadating na bakuna dito sa ating bansa, it will go through the usual and our, yung ating regulatory process. Kung ano man yung meron tayong mga regulations sa bansa, ipapatupad natin. In the same manner, kung ano man ang mga batas na meron tayo sa bansa, ipapatupad din natin. Katulad niyang RA 9184, lagi naming inuulit-ulit, hindi ho tayo magkaroon ng commitment, no, for us to prepay a specific vaccine because based on the RA law, kailangan meron kang unang-una, kailangan alam mo yung technical specifications ng bibilin mo, isasubmit mo yan, pag-aaralan, titingnan kung ma-aprobahan. Isa ngayon, wala pa ho tayong bakuna yan. Pangalawa, kailangan nakalagay dun sa batas, pagka magde-deliver na at na-receive natin yung goods, tsaka tayo magbibigay ng ating bayad. So these are the provisions of the RA 9184. And dahil dyan, medyo of course, hindi naman po tayo magpapahuli. Nakikipag-usap po tayo sa lahat ng manufacturers. Tinitingnan natin kung paano tayo mas magkakaroon ng advantage para makaka-access tayo ng mas maayos dito sa mga bakunang ito. Nick?
Thank you, ma'am. For the next question, some groups are asking for the increase of the DOH budget for 2021, which is currently proposed at 127.7 billion pesos to at least 10% of the country's GDP, and they want it increased due to the COVID pandemic. Ilang percent po ba ng DOH budget ang mapupunta sa COVID response and sa pag-improve ng ating mga hospital facilities now that we have seen the problems due to the pandemic?
Yes, alam mo, totoo yan. Ang ating budget ay talagang kasama ngayon sa ating mga konsiderasyon, yung mga nakita natin mga pagkukulang ng ating sistema, lalong-lalo na nagkaroon tayo ng pandemya. Kaya itong proposed increase in the budget, talagang nilagyan natin ng budget, no, we have proposed para ma-improve natin yung capacity of the health system. Number one, kaya nag-increase ng ganito, meron kami talagang malaking budget for health human resources. We have this year. So ngayong 2021 budget, nag-increase kami ng 27% higher compared to 2020 budget. Ang una-una nga, sabi ko, we have allotted 9.95 billion para sa health human resources compared nung 2020, no? And then meron din tayong sinasabi ng mga medical assistance for indigent patients na nilakihan din natin dahil alam natin na marami talagang mga kababayan natin ang nangangailangan. Pangalawa, meron tayong kasi mga malasakit programs. So meron tayong, pag tinignan natin ang budget with the Universal Healthcare Law, dahil ito ang talagang dapat pinatutupad natin na maging overarching strategy ng ating bansa. So with that, itong Universal Healthcare Law, nagkaroon ng components ng ating mga budget. Unang-una na dyan, meron tayo mga COVID-19 initiatives, 290 million para sa National Reference Laboratory natin, para magkaroon ng sapat na operational funds ang ating NRL para dito sa ating COVID response. Meron tayong nilaan na 2.5 billion pesos para naman ito sa mga bakuna na para sa COVID-19 na meron tayong sinet na ng mga target na mga makaka-receive nito initially for the vaccine. And then we also have allotted 3.7 billion pesos sa prevention and control of other infectious diseases, kung saan nakapasok dito yung 2.67 billion pesos para sa procurement ng PPEs at yung 1.03 billion pesos naman ay nakalaan para makabili tayo ng gene expert cartridges. Dahil alam naman natin ngayon, meron tayong 29 licensed gene expert facilities. And then also, we have other budget na nakalagay dito, katulad ng 500 million pesos na nakaalat sa quick response funds natin. Ito yung pag sinabi mong QRF or quick response funds, ito yung mga health emergency response activities natin. And this is very important, no, for our department because every now and then may mga emergencies, nagagamit natin itong pondong ito para matulungan natin ang kapasidad ng health system ng mga nangangailangan na local governments. We also have allotted 290 million pesos for the National Voluntary Blood Services Program. And alam po natin kung gaano kaimportante ang dugo, no, ang collection ng blood, especially in this time of the situation of the pandemic because marami pong nangangailangan pero yung access po natin ay medyo nabawasan because of the situation. Then we also have allotted a new line item for our procurement and supply chain management. So ito na yung magkokontrata na tayo ng mga warehouses na appropriate because we're going to procure vaccines, we're going to procure a lot of PPEs at iba pang logistics. So kailangan na natin talaga madagdagan itong supply chain and management natin kaya nilagyan ng pera dito. And aside from that, of course, we have a new budget line item which is the Health Technology Assessment Council. Ito ay nilagyan na ng budget para sa mga tao at para sa mga gagawin itong mga assessment ng ating mga experts. And of course, kailangan din natin ng operational funds para dyan. So ito yung kabuuan kung bakit yung budget natin is 27% higher than the previous year's budget. Nick?
Thank you, Yusek. For the next question, a number of our media partners asked regarding the prepay for advanced stocks of potential vaccine. Let me just read one question, Yusek. From Claire Zhao of Bloomberg, she asked, is it standard practice to prepay for advanced stocks of a potential vaccine? Is there a way for the Philippines to still do this despite the limitations of the procurement law? Or will our only option be to buy it once a vaccine is developed?
Maraming mga pag-uusap, no, na ginagawa tayo when it comes to the procurement of vaccines. As I've said, all efforts are being strengthened, no, para tayo ay magkaroon ng posisyon para we can also access vaccines in spite of the different provisions of our law which somehow restricts us, no, para dito sa mga arrangements na gusto ng ibang manufacturer. So unang-una na dyan, di ba, sabi natin, sumali tayo sa COVAX facility. Itong COVAX facility na ito, this is going to provide assistance to low and middle income countries, itong COVAX facility, para magkaroon ng equitable access ang mga bansang ito. Dahil alam naman ng WHO at saka ibang international reputable organizations na ang mga mahihirap na bansa at ang mga middle income countries hindi sila agad-agad makaka-access because of financing. Kaya itong COVAX facility, napakalaking bagay nito, no? Pangalawa, tayo ay nakikipagkasunduan na sa iba't ibang manufacturers para magkaroon ng phase 3 clinical trial dito. By doing this, we also increase our chances, no, of having this allocation coming from these manufacturers because we have agreed to have the phase 3 clinical trial here. So it goes both ways. We help with science, no? Kasi nakakatulong tayo, malalaman natin talaga yung mga epekto ng bakuna. Pangalawa, this also gives us a chance, no, to better position ourselves with these manufacturers so that we can get it. Now, with this prepayment of vaccines, no, usually kapag kaganyan, meron tayong mga ginagamit, no, na mga mekanismo para tayo ay nakakasali sa mga ganitong mga pamamaraan o mga mekanismo ng mga manufacturers, no? And ito pinag-uusapan at pinag-aaralang mabuti ng ating gobyerno ngayon para makita natin what would be the advantage of the Philippines if we prepay vaccines. Would this list of vaccines that we are now negotiating for is enough already for us? So, tinitignan natin lahat ng mga pros and cons para dyan at kung ano naman ang mga maaaring maging proseso at mekanismo if ever, no, we will be we will be advised, no, na dito sa direksyon ng prepayment ay mapunta rin tayo. So tinitignan natin lahat ng aspeto ngayon. Nothing is final. And let us remember, vaccine development takes so long. No? It's a very long process. And nandito pa lang tayo sa clinical trial stages before we get to realize a vaccine that can be finalized and manufactured and sold in the market. That would take a long time pa po. So maganda rin na ang ating bansa, habang ginagawa pa rin ang proseso na yan, tayo na po ay naghahanda kung ano ang pwede nating gawin once all of these vaccines are out in the market para alam natin kung paano tayo bibili at gaano kadami ang ating bibilin.
Thank you, Yusek. For the next question from Claire Zhao of Bloomberg, how will that ensure that we get adequate COVID vaccine supplies when the demand for doses is sure to be high?
Well, I guess I've already answered that, no, Claire, with my previous statement, no? Kaya nga ang sabi ko sa inyo, lahat po ng efforts ngayon ginagawa ng ating gobyerno para naman tayo makaposisyon para dito sa access vaccines na to. We know that our population po ng lahat ng ating gobyerno para tayo makapag-negotiate at magkaroon tayo ng sapat para sa ating population.
Thank you, Yusek. For the next question from Sandra Aguinaldo of GMA News, she asked, Yusek, ito pong number of new cases the past 5 days, can we say this is already part of the increased number of cases caused by late reporting by some laboratories? You mentioned last September 9 that we may have an irregularly high cases in the coming days due to late reporting. To what do we attribute the increased cases in Calabarzon and Bulacan, also the increased cases in Northern Luzon?
Yes, Sandra, no? I think you texted me yesterday tungkol dito. Hindi ako nakasagot. Ang busy namin kahapon hanggang gabi, no? But anyway, itong mga increase natin, kailangan natin maintindihan. Hindi lang ito backlogs, no? Hindi lang ito yung mga sinubmit ng laboratorio na hindi nakapag-submit for the past days. Of course, we still get this recent or fresh na mga submissions galing naman doon sa mga ibang laboratorio. So this is a mix of both those who have had missed submitting their timely report in the past days and also those who regularly submits every day with their recent cases. So it's a mix. Ano ba ang tinitignan natin ngayon na na mga factors kung bakit tumataas katulad ng sabi mo Calabarzon and Bulacan. Unang-una na katulad ng lagi naming sinasabi, ito ay bunsod, no, nitong ating sinasabing expanded testing. Pag tinignan ho natin ngayon ang ginagawa natin for food, and even wala yung code lahat ng isa or mga iba't ibang strategiya dito sa code, they're doing active surveillance, they're doing this efficient contact tracing. Binigay namin sa inyo ang datos, no? Dati ang contact tracing ng ating local governments ay mga 45% lang of the contacts ang natitrace. Pero ngayon, it has increased to 70%, meaning their accomplishments and the efficiency of contact tracing has increased as well. Pangalawa, yun kanilang dating ratio na 1:3 lang usually ang nako-contact trace nila and within the household lang. Ngayon, it has increased to 10. 1:10 ang nagagawa na ng ating mga local governments and it has gone beyond the households already. So mas marami silang nakikitang contacts, mas marami silang natetest. Pangalawa, alam natin po may community transmission tayo and we see clusters of infections regularly, no? Araw-araw nakapag-report kami. And for Calabarzon and Bulacan, we have seen that there were additional clustering reported in Region 4A and in Region 3 in Bulacan. So nakita natin na itong clustering also talagang ito ma-attribute natin dito sa pagdami din ng kaso. So ito yung mga factors, no? Marami pang ibang factors na lagi namin namang binabanggit. But for this Calabarzon and Bulacan, we have identified 5 new clusters in Region 4A and in Bulacan Region. Nick?
Thank you, Yusek. For the next question from the Nesca Panty of GMA News Online. Given that the President did not endorse the filing of charges against Secretary Duque over the PhilHealth mess, is this a welcome development po on the part of DOH amid the COVID-19 pandemic?
Yes, of course, no, definitely. Nagpapasalamat po kami sa ating Pangulo, no, na nabigyan po ng ganitong trust ang ating Secretary of Health. As we always say, mahirap po magpalit ng ating mga liderato kapag nasa gitna po na po tayo ng ating sitwasyon dito sa pandemic. It's really hard to have this kind of shift kapag po tayo ay meron ng ganitong sitwasyon sa ating pandemya. So we welcome it. We are very grateful. And hopefully from here on, we can continue to work and mas panatag po ang ating pagtatrabaho dahil nagkaroon naman po tayo ng ganitong welcome development dito po sa ating mga issues. Nick? Nawawala daw ako, Nick?
Medyo po, Yusek, pero okay na po.
Okay na ngayon?
Yes, Yusek.
Teka. I-off ko yung ibang gadgets ko. Ano ba to? Teka lang ha, para lumakas. Okay.
For the next question, Yusek, from Jenna Balaoro of GMA Network. Any reaction? Bakit hindi po nagsalita ang mga taga-DOH nang nag-meeting ang IATF tungkol sa pagbabawas ng physical distancing sa PUVs?
Well, hindi naman sa hindi nagsalita. Meron lang mga circumstances talaga doon na kailangan lang maintindihan. And that's what Secretary Duque have mentioned yesterday. May mga studies na pinalabas ang Association ng mga medical societies that if we decrease itong ating 1 meter distance, dito sa ating transport sector, it might produce additional 686 daily infections a day in Metro Manila. And these are assumptions, of course. These are forecasts. But of course, we'd like to be very careful also. So kung ano man po ang mga magiging desisyon ukol dito sa pagpapatupad ng pagbabawas ng distancing sa ating transport system, ang atin lang pong laging pinapaalala sa ating mga kababayan. So we still do the minimum health standards. So lagi po kayong mag-mask, lagi po kayong mag-face shield, and as much as possible kung kaya naman po ng physical distance, gawin po natin yan. Dahil iyan po talaga ay meron po tayong ebidensya na sumusuporta na kapag ginawa natin yan kasama ng hand washing, we can reduce the probability of a person to be infected by as much as 99%. Nick?
Thank you, Yusek. Yusek, would it be possible to repeat our response regarding clustering po?
Yes, for clustering as I've said, so tinanong ni Sandra kung bakit tumaas ang Calabarzon at saka ang Bulacan area. And ang sabi ko nga, maraming factors, hindi lang yan clustering. Katulad ng expanded protocols natin for testing where we are testing more than before. And we said that because of contact tracing efficiency na tumaas din, talagang na-identify natin kung sino dapat yung itetest sa ating communities. And pangatlo, as I've said kanina, because of community transmission, nakakakita pa rin tayo ng clustering of cases. And specifically sa Calabarzon and sa Bulacan. Sa Calabarzon, we have identified new clusters, 5 yan, 5 new clusters in Calabarzon, and there are 4 new clusters in Bulacan. So that might have contributed to this increase in the number of cases in these specific areas.
We hope that's better na po. Thank you, Yusek. Let's move on to the next question po from Christine Sabilio of ABS-CBN News Online. She asked, are we still seeing a declining trend in our COVID-19 cases?
Well, Christine, lagi nating sinasabi, we have to always interpret our data cautiously, yung mga numero na lumalabas araw-araw. Maraming factors that can affect the numbers that we report every day. And one of these factors would be the reporting, Tulad nga ng sabi natin, we are highly reliant on the submissions of our disease reporting units. At makikita nyo po nga yan at naipapaliwanag namin na kapag kami mga nahuhuling nagsasubmit, meron tayong nagiging mga parang mga late cases. No? Makita nyo yung mga nireport natin, meron pa nung ibang buwan. But aside from that, no, pag tinignan po natin ang mga kaso natin, hindi pa natin masabi no, if this trend is really going down. Because nakikita natin yung variability across different reported numbers per day. During the last week, we have reported a low number of cases. No? Pag tinignan natin, may araw na nag-1,000, may araw na nag-2,000, nag-3,000, compared to the week before that, na talagang nagkakaroon tayo ng mga 2,000 to 3,000 cases per day. Start of this week, we again had these numbers, no? Itong 3, 4, 3,000, 4,000. So titignan natin, no? We're trying to analyze now the recent cases and the growth, no? Yung sinasabi nating growth this is the growth curve na tinatawag na ginagamit natin ngayon, kung saan yung 2 weeks na trend of cases are being compared from the previous 2 weeks. So tinitignan natin ang bawat lugar kung ano-ano naman ito, no? So sa pagkaka-analyze namin based from yesterday's analysis, nakita natin na meron pa rin talagang mga selected areas in the country na nagkakaroon ito mga increase in the number of cases or may growth pag tinignan mo yung trend for the past 2 weeks. So pagka ganito, we can't really say, as I've said, we are not certain at this point because of these identified areas na nakikitaan pa rin natin ang pagtaas. Pero pag tinignan naman natin, Christine, ang ating health systems, no, makikita natin kung gaano natin napahinga ang ating health system comparing to before we had the MECQ in August. No? So nakita natin ang patuloy na pagbaba ng utilization ng ating critical care components of the health system. Nakita natin yung pagtaas ng efficiency ng contact tracing. Nakita natin yung pagtaas ng outputs ng ating mga laboratorio. So with all of these, aside from the others, no, makikita natin na nakakaagapay ang ating health system. And one of the objectives, sabi natin, of why we do this, we do not like to overwhelm the system. So kapag yan ang ginawa nating batayan, nakikita natin that this is a good indication that we are faring better than before. So tignan pa rin natin yung pag-monitor natin ng mga numero ng kaso sa mga darating na araw.
Thank you, Yusek. For the next question, we saw Bataan in the top 5 provinces list yesterday. Ano-ano bang mga probinsya ngayon ang nakikitaan natin ng papataas na kaso ng COVID?
Meron tayong comparison, no? Katulad ng sabi ko ngayong growth curve na ginagamit natin ngayon, comparing August 31 to September 13 versus nung August 17 to 30. And may listahan kami ng mga probinsya, highly urbanized cities, and independent component cities. So, di ko nabanggitin, Christine, we will give you this list later on. But overall, there are 53 provinces, highly urbanized cities, independent component cities, with percent increases in the number of cases. And we are closely monitoring, and we already have coordinated with these different LGUs. So we will be posting this list in our Viber group.
Thank you, Yusek. For the last question submitted yesterday, may updates na po ba sa mga vaccine negotiations? Kailan na ang simula ng African clinical trials? And kamusta na ang solidarity trial for remdesivir and interferon?
Itong ating mga negotiations na ginagawa for vaccine, this takes time, no? Hindi po kami agad-agad makakapagbigay ng halimbawa Wednesday tayo nagsabi mababago na, no? So this really takes time because may mga meetings, may mga pasahan ng mga dokumento. So sa ngayon po itong ating Sinovac, ito po ay ito pa rin yung ating CDA, as I've said, we have already transmitted it through the Chinese embassy in Manila. We are still awaiting for the response coming from the manufacturer's end. Ito pong sa Gamaleya Scientific Research Institute, ito yung Sputnik V. Yun pa rin po, nagpadala na ho tayo nung yung response natin. Although the Russian embassy is helping us na para mas maka-coordinate tayo dito sa kanilang RDIF. So I think this is the Russian Development Investment Fund, something like that. na nagmamanage po ng kanilang mga ginagawang mga evaluations for this, no? So tayo ay meron ng initial evaluation coming from our vaccine experts panel, and we have already transmitted. We are just waiting for their response naman. So we have another meeting. Hindi ko pa sigurado, no, what day this week, but we are going to have a meeting with the Russian government, no, through their embassy. As to Pfizer, yun pa rin po, no, tapos na po ang DOH at saka DOST na makapagbigay ng mga komento. We are just waiting for the comments coming from the Executive Secretary's office, and then we can already transmit to Pfizer itong ating CDA, ito pa rin Confidentiality Disclosure Agreement. As to the Moderna na bakuna, nakapagpadala na tayo ng CDA at inantay na lang natin yung kanilang response for this. So meron pa rin tayong mga iba pang mga may CDA na rin tayo na pinag-uusapan with different manufacturers of these vaccines, no? Katulad nung sa Sinopharm, yun po sa Anhui, Zhifei Longpong Biopharma, ito po yung sa Chinese Academy of Sciences. We also have the AdImmune, and of course yung University of Queensland, yung Securus, no? Ito po yung pinag-usapan last week with ng DOST with them. And we are in various stages of drafting the confidentiality disclosure agreements among these manufacturers. As to the Avigan trial, inaantay pa rin po natin mapirmahan ni Secretary Duque at ni Chancellor Padilla ng UP, ito pong ating clinical trial agreement. Aside from that, nakagawa na po tayo ng site initiation meeting kung saan lahat po ng site investigators kasama nung Sabado at Linggo this past week. Yun pong MOA with PCHRD para naman sa pondo ng trial na ito, pipirmahan na lang po at matatapos na. And then yun pong mga database na tinatawag na sinasabi natin, ito po nakapagbigay na tayo ng tablets, nakagkaroon na po ng dry run, and deed of donation is already to be signed. So hopefully with all of this na talagang lahat for signatures na lang, sana we can already start soon, no, in the coming days. As to the solidarity trial for medicines or these off-label drugs, meron po tayo ngayon, as of September 7, yun pong ating trial, meron na pong 1,009 moderate to severe COVID-19 patients na nakapasok dun sa criteria at currently ginagamitan itong mga gamot na ito among 24 study sites or hospitals in the National Capital Region, Baguio, Batangas, Cebu, and Davao. Meron na rin hong new shipments, no? So this is good news for us because yun pong shipment ng Remdesivir ay parating na po, pati ang interferon, no? Sa proseso na sila. And this would be the third shipment of Remdesivir to our country, where we are going to receive 1,000 vials coming from WHO. So ito na po, binago rin yung protocol. May bagong gamot po na idadagdag, but we will be informing all of you kapag na-finalize na yung protocol. Pero meron pong arm ng isang gamot na idadagdag for that. So maybe pagka na-finalize at na-approve yung protocol, we can already share to our media partners.
Thank you, Yusek. Yusek, can you still accommodate a few questions from media partners?
Sige, Nick.
The question of Ms. Aiko Miguel regarding the DOH's reaction on contractual employees na kinuha nila para maging contact tracers, mga 3 or 4 na buwan na nakalipas, pero wala pa rin daw pong sweldo.
I think we already have answered that, no? Last Monday. Pero ulitin natin, ano? Una-una, mali ang impormasyon, hindi yan contact tracers. Mga encoders po namin yan. Hindi po kami kumuha ng contact tracers sa central office, no? And as I've explained last Monday, I think it was Christine who asked this, no? Na ito pong mga encoders natin, of course, may mga gaps po tayo dun sa proseso. Dahil nga po because of the situation that we have, meron mga alternative work arrangements, katulad po ng mga encoders, they are doing their work at home. So, yun po mga proseso na kailangan nila magbigay ng iba't ibang mga requirements nila ay hindi po agad-agad natin napapatupad. And doon din po sa side naman ng central office, dahil nga po marami rin po ang naka-quarantine o di kaya ay nag-work from home, meron po mga minsan na nagkakaroon din tayo ng delays because of that. But we already have created a team to specifically focus on this. And our objective is for the encoders to have their salaries in these next 2 weeks.
Thank you, Yusek. For the next question, we have an ABS-CBN reporter, April Rafales. She asked, yung Baseco area na Manila Bay po, where there are still plenty of trash, including surgical masks, is it safe to consume fish from Manila Bay? And may reminder po kaya ang DOH about this, especially during pandemic?
Oh, well, lagi kapag ka basura, madumi, no? So kung halimbawa makain yan ng mga isda, wag lang may mga chemical na makain sila, doon po nagkakaroon ng harmful effects for people when they ingest or consume the fish. Ang pinakababantayan ho natin dito kapag ka mga ganito, unang-una of course, would be yung sanitation can lead to other diseases. May pandemya po tayo ngayon and it would be really it's going to add burden to our health system kung magkakaroon pa ho tayo ng mga iba't ibang sakit na kakalat because of this sanitation issues that we have. Tandaan din po natin yung polio sa ngayon and ito pong mga indiscriminate na pagtatapon ng mga dumi ng tao ay maaring mangyari at maaari din pong mainom ng mga taong maliligo sa Manila Bay kung sakali o di kaya ay nagpupulot ng mga basura at mahawakan nila ang mga nakontaminate nito. Ito po ay isa rin pong ating pinapaalala dahil alam po natin na meron ho tayo ngayong sitwasyon ngayon sa polio. So ito hong mga bagay na ito ay kailangan natin maiwasan para po hindi na rin ho magkaroon ng additional pa ng mga karamdaman ng ating mga kababayan. With regards to SARS-CoV-2 or yung COVID-19, pag tinapon natin po yung ating mga surgical mask yan sa mga ganyang basurahan, pagka pinulot po yan ng ating mga kababayan na naglilinis dyan o di kaya ay mga nangangalakal ng basura, maaari may tsansa na sila po ay mahawa dahil alam po natin that dun sa fomites o dun sa mga mask, maaari po magstay for a little while ang virus, hawakan nila mukha nila, bibig nila, ang ilong nila, ang mata nila, maaari po silang mahawa. So again, we like to remind everybody, aside from doing the preventive measures for COVID-19, wag po natin kalimutan yung mga preventive measures natin para naman po sa ibang sakit. And most especially, yung pong ating hygiene and sanitation is foremost, very important and critical now that we have this pandemic situation.
Thank you, Yusek. For the last question, we have Rafael Bosano. He asked, can you explain the rationale behind the -3 days and -9 days proxy that is used for cases that do not have information on date of onset of illness and date of specimen collection?
-3 and -9?
Yes, Yusek.
So, yes, Rafi. We use proxy, pagka halimbawa wala kaming onset of illness na nakalagay doon sa case investigation form, when we say it's proxy, it's something to replace, para lang magawa natin yung epidemiological analysis natin. When we use the -3, this is usually the time that a person is swabbed, So, ito po yung time na maaari na ang tao ay kinukuhanan o kinokolektahan ng specimen. This is the -3. As to the -9 days, Rafi, I am not familiar that we use the -9. I only know of the -3, which is the swabbing collection date. This is the time that a person experiences symptoms or the time that a person is identified as a contact, for example, and until the time that they are being tested. So titignan ko yung -9 days, Rafi, and then we will be posting in the Viber group. But as far as I know, yung -3 days is the date of collection and the time that usually a person can be collected with specimen kapag ganito. But I'll try to verify and we will be posting in the Viber group.
Thank you, Yusek. Those are all the questions we can accommodate for today. Ma'am, your final message before we conclude today's forum.
Yes, we just like to give you updates on the COVID-19 vaccines para po dun sa WHO Solidarity Trial for COVID-19 vaccines. So ang implementing agency po natin dito ay ang Philippine General Hospital. Ang project leader natin ay si Dr. Hodor Lim from PGH. The duration of this Solidarity Trial for vaccines would be 18 months. Ang total approved budget po natin, which is funded by the Department of Science and Technology, is 89.1 million. The expected start, though we say that this is tentative because things might change, would be the 3rd week of October. And then we have this list of vaccines. These are 34 in all, which are those that are being parang ginagawa ng pag-aaral ng WHO so that they can come up with a list ng mga bakuna na isasama sa Solidarity Trial for Vaccines. Pag tinignan ho itong list, ipopost namin mamaya, yung unang siyam dyan, yan na po yung mga nasa advanced stages at yan po yung mga nakakausap na rin ng Pilipinas sa ngayon. Meron na rin ho tayong mga sites na sinasabi pero hindi pa ho namin ma-share ito sa inyo. These are initial ones which have signified their intent na sasali sila dito. Pero ifa-finalize muna po namin itong areas na ito bago po namin i-share sa lahat sa inyo. But as for now, yun pong binigay namin na updates, yan po yung mga galing sa WHO. And I like to clear also, when we say that we have budget for vaccines, ito po yung operational expenses para po dun sa gagawing trial natin. Yun pong bakuna, ibibigay po yan sa atin ng WHO in partnership of course with the manufacturers. And then yung iba pa hong operational expenses, yun po yung pagkakagastusan nitong 89.1 million. So these are our updates for today for these vaccines for WHO Solidarity Trial. So we just like to thank all of you again. Sana po patuloy po ang pagtutulungan natin to disseminate the right and accurate information para po sa ating mga kababayan. Makatulong din po sana tayo na magkaroon po tayo nitong mas malawakan pang pagbibigay ng paalala sa ating mga kababayan na tayo pong lahat ay kailangan magkaroon ng responsibilidad para alagaan ang ating sarili so that we can take care of our family and our communities. Tuloy-tuloy pa rin po, ipatupad ang minimum health standards, pati po kayong lahat. Wala pong pinipili ang COVID-19 and hopefully po sana po magkatulungan tayo para po lalo pang lumaganap ang bida solusyon para po mas maisapuso at isaisip ng ating mga kababayan. So thank you very much and we will see all of you on Friday. Salamat, Nick.
Thank you, Yusek. Thank you po to all our media partners. Salamat po.